Today we're joined by Dr. Melissa Snider Adler, a board-certified physician specializing in addiction, medicine, and one of North America's leading experts on workplace substance use, cannabis, impairment, and medical review officer decision-making. In this episode, we'll separate fact from fiction as we discuss what drug tests can and cannot tell us, the science behind impairment, the challenges facing employers in today's evolving workplace, and what every designated employer representative, manager, and safety-sensitive professionals need to understand. Whether you're a DER, employer, collector, substance abuse professional, medical review officer, or simply interested in the future of workplace drug testing, this is a conversation you won't want to miss. Let's get started. Well, again, have heard the intro. So we're here now and about to get started, and I appreciate you being on, Melissa. So do I call you Dr. Snider or?
Oh, no, please just call me Melissa. Please.
Everybody, I kind of get mixed up with that because people have their titles, and
Yeah,
and when she first emailed me, it wasn't like, "Hey, Greg, can you please?" She said, "Don't call me that. Call me this," and I was like, "Okay."
exactly.
So,
Exactly.
all right. So Melissa, you spent more than 2 decades at the intersection of addiction, medicine, workplace safety, a regulatory policy, from launching opioid treatment programs to shaping national impairment standards. But before we get into the specifics of workplace substance use, what originally drew you into addiction medicine, and how did that path evolve into becoming one of North America's leading experts on workplace impairment?
Well, I'd like to say that I have this great story. The truth of the matter is this: if you would have asked me in medical school or residency what the likelihood of me practicing in addiction medicine, I would have said absolutely zero. It's the bottom of my list. I would have done things that I really didn't want to do prior to that. My history of it in residency, truthfully, and this is just the sign of the times and what we were taught. I would, in we would go and do our rotations through emergency medicine and everything else. But in emergency medicine, I clear as day remember somebody saying to me, people that come in, if they are seeking substances, seeking pills, whatever, just get them in and out of the emerge as fast as you can. And I remember that. And that was sort of my, at the time it was like, okay, that's just what we do. And it really took away from seeing these individuals as people. And when I started practicing family medicine, I worked with two doctors who had an addiction medicine practice. And I actually remember saying to them, I will join your practice. I don't want to see any of those patients. Now, I have a background in psychology. That's my undergrad. And so they kept saying to me, you'd be so great. You would really like it. And I honestly tried it because I just wanted to put it to bed and just say, stop bothering me. I just is not an area that I want to practice in. My very first day, I had a patient who, you know, probably is the epitome of what we think about when we think addiction medicine. When I say to people like someone with a substance use disorder, just picture somebody in your head, that he would be the picture of that. Earrings, tattoos, a little bit disheveled. But I was talking to him for all of 5 minutes, and he said to me, "You know something? You were the only doctor who has ever looked me in the eye and actually talked to me like a person." And that was it for me. Like, for me, that was like, seriously? And I mean, this guy was a brilliant person. Like, you could just tell by speaking to him. And in that moment, I realized, wow, these are I think it brought me to realize that these are people who are really suffering, and that there is huge stigma. And just talking to somebody for 5 minutes elicited that. It's crazy because in family practice, I never had that, right? In family practice, it was always the feeling of we're not doing enough as physicians, and what more could we do for the patient? And so over time, and I think it took me not even about a year or two of practicing addiction medicine where I said, I want to do this full time. This is sort of what I want to do. Because it was gratifying, and interesting, and it taught me so much about people to understand that these are people that have histories, and it could be anybody. I had lawyers, I had doctors, I had teachers, I had construction workers. In my practice, and I do believe this. I think the IQ of my practice is higher than the general population. So it's not what people think. It's not what I think. It's not what I thought. And that's my addiction medicine background. So it's been, yes, as you said, over a couple decades now of me practicing, and I still see patients. The workplace stuff sort of evolved through that, and this is the other lesson that I tell residents who I'm working with is you have to look through the door sometimes and not just make assumptions. And so, through addiction medicine, I met somebody who was an MRO, and he started a TPA in Canada, and he wanted me to come work for him from an addiction medicine perspective. And I kept going back to the workplace stuff. I found it so fascinating. It was just not something I knew anything about. And he's like, I don't need anybody from an MRO perspective. And I just kept going back to him. And one day he came to me and said, okay, I need an MRO. I need a full-time MRO. Can you do this? And I just kind of just said yes. And over that, when you put the two together with addiction medicine and MRO work, and really diving into the whole workplace safety part of my practice and understanding that substance use goes far into workplace safety, substance use disorders, substance use, and people and companies and employers are really challenged with this, with managing it, with understanding it, and everything just sort of took off from there. So these are the things that I never thought that I would end up doing, but again, doors open, and when you look through and you take that step through, it kind of brings us to somewhere that we may not have thought we would be. But I mean, I love what I do. So,
So let me ask you this, not moving forward, but I want to kind of go backwards because you said something about the guy, the
mhm.
that you're the first person to view me as something. How in your profession, like how often do you get that in that space? Like, and why did he say that? Like, do
Yeah,
you know like how the human side of that statement? Like
yeah,
that's
yeah. And I mean, it really, I have to say, it really hit me. But it hit me because I realized that as prior to that moment in time, was part of that problem. And it is that people who are suffering, and really it could be patients of it with chronic pain, it could be patients with not even maybe substance use disorder, but just people that are suffering, can be challenging to manage because we can't, as doctors, we and healthcare providers, we want to fix everybody, right? Like, I want to make everybody feel better, and when it becomes very challenging, patients can become more challenging because they're suffering. And you know dealing with patients sometimes with substance use disorder who may be coming into the emergency room in withdrawals, or who don't feel well, or whatever that may be, who are suffering from a mental health perspective. Unless you sit down and you take the time, and as healthcare providers, we don't have enough time. It is a consequence of the way our systems are, both in the US and in Canada, that we just don't have the time to sit down to give the patients what they need at times, especially when they need something that is hard to, we're not taught in medical school how to handle this, how to deal with it. And so, there's a lot of stigma. There's a lot of people out there, healthcare providers, community, employers, who believe that people with a substance use disorder or who use substances, have they're like, they're these people that just don't really matter, or that they're not trying hard enough, or that they have issues with their morals and their values, and they don't often we don't look at people as people who have substance use disorder as people that have a medical disorder that need to be treated like anything else that we have, where you are having symptoms that people don't understand or don't know how to treat you. And so that is something that I hear all the time from my patients. I feel like it's getting a little bit better, but nowhere near where it needs to be. Um, one of the big take homes for me when I started bringing residents and I started teaching residents about addiction medicine, they would come into my practice. The one thing they said to me, and this really shows you what we think and what we're trained as healthcare providers. Oh, your patients look so normal. Now, I
What
don't
is
like the word
normal?
normal. I don't like the word normal, right? But yes, my patients look like your patients in your family practice clinic or in an endocrinology clinic or in a neurology clinic because they are people, from all walks of life, all ages, and all intelligence levels and all occupations. So they are parents, they are children, they are siblings, they are friends, they are aunts and uncles, they are people. And I think and this is society, that we look at people with substance use disorders as, why can't you just get better? Why can't you just stop using the drugs? Why are you doing this to us? Right? Like that's really how a lot of people look at it. But when residents say that to me, I feel like, okay, I've done good here. Like, yes, because they are the same people that are in your practice. They're just here for something different. And when we start treating them like real people that have a chronic medical condition, what changes is like night and day, just from a demeanor perspective, from a positivity perspective of the patients, the outlook, their hope that they can get better because somebody sees them and believes them. And I think in society, that's not always how they feel, or more often than not, that's not how they feel.
So let me ask you this then. So you mentioned that education has always been passion of yours because
Hmm.
you keep going into your education past, right?
Yeah.
Even going back to to that time, let's go back to you teaching piano lessons
Yeah.
as a teenager. Like, how did that early passion for teaching influence the professional that you become today? Does that correlate with anything?
Yeah, it's so interesting. My mom's a teacher. So, I grew up, my dad's a musician, and so I kind of grew up with both. I grew up playing piano, and then when I got to the point where there were no more lessons to take, I had finished Royal Conservatory, and anyways, I was still taking lessons, but I just decided I wanted to teach, and I mean, at that point, I think I was all of 15 years old, 14 years old.
Teaching piano at that age?
Yeah, yeah. I really just wanted, like, this was a job for me. Like, I just wanted to make a little bit of money. So I could buy something for myself. So, but I loved it because I had a handful of students, and it was just sort of neat to kind of see people like learn and like to learn and figure things out. And some of them didn't love it, but that's okay. It was sort of interesting. And that turned into, for me, tutoring different subjects when I was in high school, when I was in university. You know, for a while, I actually wanted to be a teacher. Like that was something that I thought, oh, I'm going to be a teacher. And I thought, no, I'm going to go into medicine. It was just sort of a, decision just like that. But looking back, I feel like teaching, educating is like absolutely part of who I am and something that I definitely have a passion for. And I think I always have, but it has definitely informed a lot of what I do, but I don't know that I necessarily put it all together until more recently, right? Like it's just, oh yeah, no, of course I teach residents and I go and I lecture and I give, I speak at conferences and I just think of those things as all individual things, but in reality, it's not. It's all educating, it's all teaching, it's all about taking information and breaking it down. And
All
I
connected.
I like seeing that little like light bulb go off, like, wow, okay, that's interesting. I didn't think about it that way. And that's with everything. When I was tutoring, when I was teaching piano, when I'm in an arbitration or court in front of an arbitrator or a judge, whatever it may be, like that little light bulb that goes off to bring some clarity and understanding to something that can be really complex and hard to understand, to me is like there's nothing better.
So you're out of Canada. So is
Mhm.
there any significant difference between how you guys do treatment there and processes than the US? And let's say if we're speaking from the safety sensitive perspective of testing, is there a significant difference?
No, I mean, from a workplace perspective, it's very similar. What I will say is that, I think we do have, I know we do have the same challenges. Access to treatment, getting people into treatment. Although our healthcare system is paid for by our government, not everything is. So, therapy, counseling is not. Some treatment centers are covered for some people, but they have huge wait lists and, they're short programs. And, when people need to go to a longer treatment program or they want to get in quickly, they're paying the same amount that they're paying in the US basically. So, and access to what people need beyond just inpatient treatment centers, like, everything from nutrition to psychology to social work to occupational therapy, any of those are not covered. And so we have the same challenges from that perspective. But we do, from a workplace perspective, it's similar. Like, generally speaking, if someone were to disclose a substance use disorder, they're sent to a substance abuse professional for an assessment with recommendations for treatment. They'll go for treatment, so and it takes a long time. From that perspective, there's not a lot of difference.
So
Yeah.
what does FFD stand for?
Mm. Fit for duty. So, um, that came out fit for duty learning, really. Um, why? Because truthfully, for years, I've been a consultant. So I'll go into workplaces and talk to them about substance use or substance use disorder and really helping them manage usually the challenges that they're having. They don't usually bring me in unless there's big problems in the industry, in their workplace. And for so long, people would say, I'm going to fly you out and you'll speak to all of our workers. And they have me over a couple days and they bring all the workers in and, it's an hour or so that they get to spend with me while we talk, which, as you know, is great. I'm not going to say it's not good, but it's nowhere near enough for what people need to have something sink in and see a change. And I would say, as part of kind of managing substance use issues, we really, you need to educate your workforce, not just training for supervisors or managers. Most workplaces do that. Training to detect impairment, to understand reasonable suspicion, et cetera. Most workplaces will do that. But I know that you think that employees should understand that they can't use substances and go to work. But even when you have a zero tolerance policy or when you have a drug-free workplace, when you ask workers what that means, you will get a whole bunch of different answers. Oh, drug-free workplace means I can't use at work. Like, what about the night before? What about the day before, right? They don't necessarily understand. And employers and people in the industry, we make assumptions that, well, they should all know they can't use drugs and come to work, or they shouldn't use on the weekend, or they shouldn't use the night before, or whatever that may be. They should never use any substances, but even alcohol. Alcohol's legal, and we may say, okay, well, don't use X number of hours before. But what if they have, a case of beer? Or what if they drink a 26, 26er of whiskey? Like, the effects go on to the next day. And so these are the types of things that I kept saying, this is what you need to talk to your workforce about. This is what they need to understand. You're doing drug testing. They know what's being done. You tell them not to test over a certain limit, but what does that mean? Right? How do they do that? How do they comply? So I kept looking for that. There's some out there. There's not a lot. And so I just decided I'm just gonna do this. I'm just gonna develop it because I kept saying you need to do this, you need to do this, but where do I get it from is the next question. And so and really it comes down to being fit for duty. And
Right.
it differs from workplace to workplace, truthfully, their definition, but
So you have FFD and then you have ASAP.
Yeah.
So are they joint together or how does that work? And tell people
Yeah.
what is ASAP? I mean, for those who don't know.
Yeah, sure. So, I mean, FFD Learning is just the company name, and ASAP, which is the um, alcohol and so yeah, I think I would know this, alcohol and substance awareness program. You can cut that part out. Okay, so the alcohol and substance awareness
I
program
was
is
just
just
saying it in my head and I thought,
yeah, I know. Anyways, that's just one of the. I mean, it is now the main program, but one of the programs from an education perspective. So that is really all about exactly what it is: alcohol and substance awareness program. It is a program with multiple different options for courses and lessons, all about substances. And what I quickly realized is that, as I was sort of alluding to, not every employer's definition of fit for duty, believe it or not, is the same. So, what do I mean by that? We have places that it's zero tolerance, drug-free workplace, absolutely no substances. We have some that are just don't use within a certain period of time before work. We have others that are don't come to work under the influence or intoxicated or impaired or whatever word they may want to use. And so the messages are different and their expectations are different and their policies are different and their testing is different. So, it's all, it's, there are lessons and courses for all of that because it differs, right? From industry to industry and workplace to workplace.
so you often emphasize from my understanding of CCP, which is clarity, credibility, and practicality, right? In your
Mhm.
education. Why are these three elements so important in your field?
Yeah. So, clarity is huge. I mean, and what I mean by that is that if employees don't understand when I go and I talk to employees and I say, okay, can you guys all tell me what it means to show up fit for duty? Can you tell me what it means to don't come to work under the influence? When they don't understand it, when they don't have clarity as to what this means and have an understanding that is the same as what the employer expects, then they can't comply with anything. Because if you don't understand and you don't truly, you know, you can't explain it because you don't know how to follow it if you don't have clarity of what it is to be able to comply with the policy. And most employees want to comply with the policy. They don't want to lose their job. I mean, their job is usually, for most people, the most important thing in their life. And I hear it. I hear it from people with substance use disorders who just say to me, like, I can't lose my job. It is the only, for many people, stable thing that they have where they have a routine, they know what to expect. But if they don't understand what it means to be able to be compliant because they don't have that clarity, then we can't expect the rest to go forward. And so, I mean, that's a big part for me. And that is why, yeah, I have, standard programs, but I customize it to be able to ensure that that clarity matches what the employer wants. And once you have that, I feel like, yeah, are there going to be people that even when they have the information are going to do what they want to do? Absolutely. We all know that. But there's a lot of people that want to be compliant. They just don't know how. I didn't know. I had no idea. That again, that light bulb going off. Like, I didn't know. I didn't know that if I use before bed every night that I can test positive or that there's a risk of impairment or just because I have tolerance to alcohol or cannabis or stimulants, I can still, have issues with respect to impairment, cognitive deficits, and things that can affect specifically safety sensitive work. So it's all of that. And that's something I really feel really strongly about because I don't feel, I think we have expectations of employees often, and I don't know that they really truly get it. I don't think they get that whole impairment piece. And that substance can last longer. And when you speak to people, they'll often just say, well, no, you're just making up these arbitrary rules. Like they're arbitrary. Like you are against cannabis or marijuana or you're anti-marijuana. It has nothing to do with that. You know, it doesn't. It's about safety. And when you understand that,
And, you know,
yeah,
so
yeah.
then that leads to then if we're, talking about the clarity and the credibility of things, so then that will lead me to the leaders and the supervisors, right?
Yeah.
So what do you think is the biggest misconception that leaders and supervisors have about impairment detection?
So, I there's one big one, and that is that, and I'm not saying that we don't need this. So, reasonable suspicion training, it's really important, right? You need that. You need to understand what signs you may see, what things to check, and be able to document it and understand it. But there's a whole subset of people that come to work under the influence of a substance who are impaired that you would not know by looking at them. You may know when they come in withdrawals from their substance, alcohol or opioids or benzodiazepines, right? When they're using it every day, you may think something's off. They call in sick a couple times. It's usually on a Monday morning. Sometimes they take longer breaks. You hear people say things about their mood that may be slightly different. But I often will hear, no, well, I thought that they were fine. Like I didn't really see any signs of impairment. And yet you bring them for a breath alcohol test because of an incident, for example, and they're, blowing at 0.21 or something really high. And you think, well, I should have seen something, but we don't always see that in a person who uses it every day. So the biggest misconception is that not all impairment is visual. We can't see when somebody can't divide their attention. We can't see when they can't recall information. We can't see when they can't sort of put all the information together about what they're seeing, about their reaction time. So those aren't things we visually can see on a person. Their brain may not be functioning properly, but until they are put in the situation where it's taxing and they need to use that, the judgment, the decision making, etc., we don't visually look at them and see that, and yet they can be highly impaired. So that's that's a big thing. And the other and is people have to trust their gut a little bit more. I think people are afraid to do that. Supervisors, managers will usually in retrospect say, yeah, I knew something was up, or I felt like there was something going on, but I wasn't sure. I didn't trust myself. I didn't know how to approach them. There weren't really any signs of impairment, so I didn't say anything. You know, and sometimes we need to go back to sort of take a look and think, what's changed in this person and what am I actually seeing? And taking it and really thinking about what you're noticing, whether there's a pattern, and kind of sitting with it for a little bit to really trust your gut when you feel like there's something going on. And those are the two
I
big ones.
I think that when we talk about the testing, right? We have the pre-employment, random, post-accident, reasonable suspicion, follow-up, return to duty, right? Of all of those, I believe that reasonable suspicion and reasonable cause testing is probably the only testing that I believe that really uh, infringe upon the people making the decisions character, their
Yeah.
integrity,
Yeah.
their ability to be honest, you
Yeah.
know, with that decision, right? So do you speak on that aspect of it about them, because I and before you answer that, like I'm thinking in my head from my perspective as a former inspector, I would go to a small company where they're more family oriented, they're
Mhm.
more apt to want to take care
Yeah.
of each other, in that setting versus a bigger conglomerate, right?
Yeah.
So from that perspective and that angle, as you're talking about, we're talking about these leaders and supervisors. How do you address that? Is that in your training as well,
I
or is
mean,
that just as it comes?
yeah. It is, it is there from a supervisor perspective, and I hear what you're saying because it's true. I mean, but it's sometimes reframing it. And what I try when I'm speaking, when I go out and I'm speaking to leaders and I'm speaking to supervisors and managers, it's sometimes reminding them that when somebody, when you're concerned about somebody
Right.
and you reach out to them, whether that may be for a reasonable cause, reasonable suspicion test or not, it doesn't have to be punitive. It may feel like it is, and it is for a lot of people, but sometimes that is the first thing that individuals need in order to get the help that they need. It's also the first thing that sometimes people come and say, it's the first time that somebody actually noticed me and really saw me and saw what was going on, and they obviously cared. And so there's two different ways of looking at it. You look at it and you think, well, you're pointing at people and you're picking out people and you're sending them for the test in a very negative, really a very negative frame that we can put that in. But when I ask my patients who have been in that situation, 'cause sometimes they end up seeing me afterwards, they say to me, had that not happened, I probably would have died from my addiction. Had that not happened, there would have been a big incident or something that happened that could have, could have harmed somebody else. And I don't think I could have lived with myself with that. So it's just the reminder that sometimes these things that we feel in the back of our head that we're doing is harming the person may actually be the first step and the first thing that they need to get the help that they need. And when it's done with compassion and when it's done with curiosity and not with shame and judgment that we put forward, because people pick up on it, right? Like when you talk to employees as a supervisor, they know. I mean, they will know what you think about people that use substances, people that have a substance use disorder without you even saying anything. They feel and can internalize that compassion and that true care. And so in small family businesses, I said, well, if you really care about people, then you don't want to leave them alone and you don't want to not approach them. You want to talk to them. It's just how you do that with compassion. And and that's the hardest thing. But so it's a hard thing to teach in a short video. It's a much easier thing to talk about in person. So a lot of that is more about the in-person training that I do for workplaces for leaders, but there is some of that in the supervisor training that I have because we forget that, right? There's a lot of negative connotation when it comes to drug testing. I mean, I hear it all the time, but patients of mine and people that I speak to with substance use disorders tell me the thing that gets them through those first year or two is often the fact that they are subject to unannounced testing, follow-up testing. They know they're going to be tested. They do not want to lose their job. They do not want to be off again. And so that decision of do I use or do I not use? Do I go out with that friend or not? Do I, do a line of coke at a party when everybody else is? Actually, I'm not going to because I don't know if I'm going to be called on Monday for a test and I can't have a positive test. That it actually is protective. And many individuals appreciate it. Like we see it as such a negative thing, but it may not necessarily be. It may be the thing that actually helps people through challenging times. Those first couple of years are really hard for individuals with substance use disorder.
And I think it, because I talk about that as well, that I think they just, like I said, there's a difference between empathy and sympathy,
Hmm.
right? And it's,
Yeah.
you know, okay to, to have empathy with someone, but sometimes sympathy takes them, down a road where they start trying to protect,
Yeah.
right?
Yeah.
They start trying to protect and in the world of safety sensitive, I think because they know the consequences, that comes with it. And the first thing is that I don't want this person to lose their job, as you were
Right.
alluding to. They're such a great person. They
I
made a
know.
mistake and they
Yeah.
go down this road with them to where it hurts them more than helping them instead of just
Exactly.
being, just upfront with them and getting
Yeah.
them help.
But it's enabling also. And, I mean, workplace, I will often ask workplaces and say, how often do you do reasonable cause, reasonable suspicion? Not non-DOT usually. more so. How often do you do reasonable cause, reasonable suspicion testing? Oh, hardly ever. We really never need to. But that's a sign, right? That is not because there's nothing going on. That is because either A, you don't know what to look for, B, you don't know how to have the conversation, and C, you don't trust yourself enough to know that this is helping somebody and not hurting them. Um, Whereas the opposite is, it's that whole enabling part. And that, and when you put it into those terms, it's like, oh, okay, I see. If I'm ignoring it, I'm actually causing more harm potentially, not even just the risk from a workplace perspective, but to that person because it's not allowing them to get the help that they need, which is sad, right? I mean, people spend more time at work than they do anywhere else. And so when people say, well, why is this a workplace issue? Why do I need to be the one to deal with it, right? They should come forward but think about how many hours people spend at work and right? When you take into consideration how long you sleep, and then you take how into consideration how long you're at work, I mean, the workplace is where things come out and it's our greatest opportunity to get people heard, seen, and then the help that they need. And sometimes we don't think about it that way, right?
So if you're talking to your HR professionals or these leaders, take your program, right?
Hmm.
Um, what is the main thing that you would want them to walk away with after attending your thing? Like, what is that thing for you?
Yeah,
Yeah.
it's well, my big one of my passion obviously is substance use disorder. So I have a whole course with a ton of lessons all about, what is a substance use disorder and that it's not a moral failing and that it is a medical condition and, um, you know, even things to recognize in oneself. It's interesting. We look at employees or the workforce and we'll say substance use disorder and substance use and everything else, but we forget that our managers and supervisors and leaders are still people and they do not have zero risk of substance use disorder. In fact, there's some argument to say that they may have more substance use, and there have been studies that look at the amount of substance use, just a use of substances before and during work in supervisors and in the rest of employees, supervisors, managers, leaders, and the rest of employees, and it's significantly higher. So part of it is also seeing them as people that also may be suffering or may have their own ideas about things that then kind of come across to the workforce. So, putting everybody on the same, because that's really what it is. Everybody's a person, everybody has the same risk. And it's also being able to look at oneself, no matter what position that you're in, to see whether or not your substance use is problematic. Maybe it is, right? We talk about employees, and we think our supervisors, like we just need them to know how to detect it. But sometimes it's being able to understand it for themselves or a family member or somebody else and to have that compassion. So, for me, it's a substance use disorder one that and the stigma associated with it. And I have a lesson, words matter. Just how we talk around the workplace is heard by people and it makes a huge impact. And so just things like that, that's my passion. What everybody else wants is just to know about cannabis. How do I handle cannabis in the workplace? What do I do with marijuana? With all this, that's just what everybody wants to hear about. But for me, if I can make a little headway on the really deeply understanding, getting rid of that kind of narrative we have, whether it's how we grew up, whether it's people that we knew, anything, and change that narrative to, okay, this is a medical condition, and in all likelihood, their substance use is a symptom of a bigger problem, not coping, stress, depression, anxiety, PTSD, chronic pain, whatever that may be. And looking at it from that lens as opposed to like the what is wrong with you lens. Why would you do this? Why can't you just get the help? When we look at it from the other lens, and I hope that after watching some of this, that light bulb does go off for a moment. And the truth is that the more understanding leaders and supervisors are, the more likely you're going to have people that come forward to disclose. And from a safety perspective and a cost perspective to the employers, I mean, that's the best thing that you could ask for. Um, from all aspects. So no matter what your priority is, if your priority is financials, it's going to save you significant time and money. If your priority is safety, which it really should be for all of us, there is no doubt that somebody with a substance use disorder who comes forward, who gets the help that they need from a safety perspective, you know, even if there hasn't been any incidents, they're like this much away. People say to me, "Well, I've been doing this for so long and I've never had an incident at work." I said, "Okay, but that's like saying I was driving drunk every day and I didn't get in an accident, therefore I'm safe."
Right.
It's just yet is the
Yeah.
word. Yet, you know? Yeah.
So since you brought up marijuana, so how does marijuana legalization and changing public attitudes create new challenges for employers and safety sensitive people?
Yeah. So I will say that I think that when I speak to employers, what they tell me their biggest challenges is truthfully dealing with marijuana. I mean, there is no doubt in Canada where it's been legalized since 2018, there's still, I mean, every day it's something new, and employers and leaders and supervisors are still challenged to deal with it. And in the US, you guys are like just coming up to that panic of, oh my gosh, like the landscape is changing, rescheduling, who knows what's going to happen. Right now, is there going to be a safety carve out or not? Like, there's a lot of angst, there's a lot of uncertainty, there's a lot of unknown. But the biggest challenge is that what is out there on social media and just what everybody is hearing is, oh, well, they wouldn't be doing this, they wouldn't be legalizing it, they wouldn't be rescheduling it, they wouldn't be, even considering doing these things if it wasn't safe. And
Right.
that's the narrative. That's what's out there. And so, from an employer perspective and from a safety perspective, that's really hard to go up against because they're hearing it from friends, they're hearing it on the news, they're hearing it in social media like safe, 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 it's fine, it's no problem. Those are just anti-marijuana people. Like that's a hard thing to go up against. And so is it challenging? It's a huge challenge, and it's going to, I hate to say this, but it is going to continue to be a challenge. How do you deal with it? I mean, one of the big things is to continue the narrative to go up against what they're hearing, to explain that there is a difference between you having a job where you're answering a phone and where you are operating crane or underground working in a mine or, you know, oil and gas, whatever it may be, driving a train, flying a plane, like whatever that role is, that is
Right.
very different. And the standards have to be different. And if you understand a little bit about how it affects your brain, because it's going to your brain, whether it's legal or it's not legal, it's going to your brain. And so you know, again, I know it's like I'm pushing education, but I truly believe that that's part of what we need to do is everybody needs to understand why it is that these rules are in place. What started it all, as we were talking about, right? What started it? Well, let's talk about what started it. Let's talk about the deaths. Let's talk about the injury. Let's talk about all of that, and what could happen. And so, like, to me, it's a big challenge, but and it's going to take time, and it's going to take time to get everybody understanding that this is completely different in safety sensitive world than it is in your own, world of doing either not working or working at something that's not safety sensitive. It's very different. And I think that is something that we need to keep pushing and working on. But it is, I will tell you that my feeling is that the whole concern around cannabis has opened up employers' minds to understand the need to talk about substance use, to talk about risk, to relook at policies, to relook at testing, to, you know, educate their workforce, to reinforce it on a regular basis. Like all substances, not just cannabis, but it's opened up that conversation. And I think that's really important. We weren't really talking about substances. It was just oh, they're all illegal. Nobody should be using them. Case closed, end of story. Everybody should know. To now, oh boy, here's a problem and we need to address it. So,
And so what trends are you seeing today that concerns you in the workforce? Are you seeing
It's
things that are like
the, yeah. I
got
mean,
you talking?
truthfully, yeah, it really is the normalization of all substance use. Like everything, not just alcohol, not just cannabis, cocaine I know when we look at trends, we're not necessarily seeing massive increases in positivity rates for cocaine. Anecdotally, we are. In addiction medicine, we are. Cocaine use is becoming very normalized now again, and even methamphetamine. And so it's the no big deal from society, that whole just legalize all drugs because what's the big deal? Let us do what we want to do. The pendulum is kind of swinging now the other way, right?
So we'll
That
be
to
back
me
at
is what's,
Woodstock.
yeah, yeah. I mean, honestly, it's from a workplace perspective, that is the thing that really concerns me. It's when as an MRO, when I speak to employees, it's shocking. Everyone does it. Like it's when I hear everybody does it, it's no big deal. And they're not always just talking about, not just, but it's not only about cannabis. I hear that about cocaine. I hear it about methamphetamine. We don't have a lot of PCP, so I don't see PCP. And opioids, I think from a media perspective, we do a pretty good job of with our opioid epidemic. And what I mean by that, it's in the news. People know that there are risks with that, so it's not quite as normalized as cocaine, other stimulants, using somebody else's, stimulant medication, prescription medications, benzodiazepines, sleeping pills, etc. So, that to me is what scares me the most is just how that pendulum is swinging so far the other way right now. And that's, again, the need to kind of get out there and have voices heard and explain things a little more deeply so people understand and they can see that while they think and they hear that everything is safe and fine, it's actually not. Um, yeah.
So when you're talking and trying to get my last bit of things that I want to get out with you.
Okay.
Um,
Sorry, I talk a lot.
so
I'm
do
sorry.
no, that's what you're here for. I know,
Yeah.
you'll listen to me somewhere else. Um, you do policies, right? You help companies with policies and things that,
I
so
don't
what,
write policy, but I do help them implement it and sometimes help them reconsider what they write in their policy. Because, yeah.
okay. So when you're trying to give advice to them, trying to create, policies that are both fair and safety focused, what bit of advice would you give in that angle?
I think the advice of not doing what we always did just because you always did it is probably the best thing. I mean, I hear, well, we've always done it that way. Okay, but that may not be maybe it is still okay, but maybe it's not. And so it's relooking at, really relooking at what your priorities are. As I said, I can take 10 different non-DOT, I mean, DOT is different, but non-DOT employers in the same industry even, and their priorities with respect to substance use are different. And maybe it's because they're having difficulty hiring. Maybe it's because they know they have a massive issue with substances in their workplace. Maybe but it's all over the place. And so sometimes it's sitting down to figure out where you fall on that risk, safety, balance, people desire to use a substance. I won't say right. I will just say desire to use a substance and deciding where you're at with that and then making sure that your policy aligns with your priorities, making sure that the testing that you're doing aligns with that. It answers the questions you need answered. And taking another look at some of the language that's in the policy. We often talk about impairment in policies. Well, we have a way of mostly kind of associating an alcohol test with impairment, but we don't have that with anything else, with any other substance. And so when we say, we're testing, you can't be impaired at work, but we're not doing functional impairment testing, then how do you measure that? Right? Because then you get into, well, I had a positive oral fluid or a positive urine, and you can't prove I was impaired. But I can prove that you use a substance in a time frame that put you at risk. So what needs to change is the language in the policy. So it's to me, that's how I challenge employers to really look at their policy from that lens, from a defensibility perspective, but also from really considering what your own priorities are. DOT is relatively easy, right? Like it really is. You got to regulated testing, regulated workplaces. It is what it is, and you don't have to decide. You just have to do. But for non-DOT, it's a
It's
little all
rough.
over the place. Yeah, yeah.
Right, so what message would you give to leaders who avoid these difficult conversations around substance use because they feel uncomfortable or unprepared? Like what advice or how often do you run into that?
A lot. I mean, we all avoid things that we're not comfortable with. We all avoid things we don't know how to do, and it takes practice and it takes time and it sometimes takes understanding it in a different way to allow you to have those conversations, and thinking about it from a different perspective. So, when I talk about perspective, I tell people I want you to picture a vase, like a square vase. And if I'm looking at it just on this, from this angle here, sitting in front of me, I'm seeing one side of it. And until I walk around to the other side or I turn that vase, I don't know what's on the other side. And I don't see that view from the way other people do. So it is taking the time to understand what's really going on. When you bury your head in the sand, you don't see anything, but that doesn't mean that it doesn't exist. And sometimes that is what costs the most from a safety perspective, from a injury perspective, from an incident perspective, from a just a cost perspective. When we bury our head in the sand, we don't see, we don't help people, and we end up getting into trouble. And you don't want to be the one from the incident perspective that has some massive incident with consequences and injuries or fatalities because you didn't know what to say. And so knowing that substance use occurs in every workplace. And the ones who say, "Oh, I don't have any issue with substances," I say, "Well, you're not looking hard enough because I guarantee it's there." It's learning to know that you're uncomfortable and then taking the steps that you need to understand it, to know how to have the conversation, what the words are to say, and really the positive benefit and what you're really giving employees when you stop ignoring it, because it is giving them a chance to be seen, a chance to be heard, and a chance for somebody to actually know and see them for what is really going on. And sometimes that's just mental health issues. It may not be substances, but it's all the same conversation, right? We tend to avoid those conversations because they're tricky and they are hard. But
And I
and,
always say there's nothing becomes a problem till there's a positive refusal or an accident, right?
right,
Like,
right, right. And let's be proactive. Like, why wait for something to happen? Why not be proactive? We are a very reactive society in most workplaces, right? When we look at testing, most of our testing is post-incident, reasonable cause, reasonable suspicion. That's reactive. The problem's already been there, and it didn't just happen that day. It's probably been going on for a long time. And so let's try to be a little more proactive because nobody wants to deal with a positive test. Nobody wants to deal with an incident. Nobody wants to deal with a fatality. So that's I think what my message is let's open up, let's be proactive, not reactive, and take the steps that you need to give you the ability to have those conversations with confidence because it is learned, it is hard. Yeah, I'm not saying it's easy, it's not, but we all could get there. Um,
so you're like the advice, like for those leaders or whatever who may challenge, that's why people like you are there, right? Like they may struggle with this and not just training or whatever, but they need that voice of
yeah,
of confidence and understanding. And that's why, individuals like you exist, so that they can say, hey, I'm having trouble with
with
this,
this,
right? I don't
yeah.
know how to move forward with this,
Yeah.
right?
Yeah. And
Yeah.
I mean it's also taking the full responsibility from the leaders and the supervisors and managers and putting it into the workforce as well for each and every person to be responsible for their own safety, their own fitness for duty and for those around them. Like when we take a collective and we start changing that culture to we're all going to be responsible here. Like because when Joe next door to me comes to work impaired or under the influence, that's going to potentially impact me. And so, it's giving everybody the knowledge, the voice, the ability to be able to, bring things forward. And again, have that conversation. There's lots of people out there that have, experience in this and they know how to talk to individuals. And if you can't do it, that's okay. But there's lots of people that can either help you get there or can help with that. So, but when we bury our head in the sand, inevitably, we're waiting for a disaster to happen. So,
So before we close, um, have to ask you this. If you could leave the employers, HR professionals, your safety leaders with one lasting thought about workplace safety and substance abuse, what would that be?
it would be that substances are pervasive. They are there. There are in every workplace people that are using substances, sometimes not in a, when I say problematic, I mean, it doesn't all have to be substance use disorder. They may just be using it in a way that still impacts the workplace. And so, A, knowing that it exists, B, taking the time and the energy to be proactive, to to get people talking about it. The more you talk about substances, the more it becomes top of mind. When we put it in the back burner and we don't deal with it, that's when things come up. So bring it to the front, talk about it, educate people, bring it forward, have it be part of the day-to-day conversation. It's hard, but it is really important. It's like anything else. When we don't talk about it, it grows like a weed and it becomes out of control. And then to pick out that afterwards and to pick up the pieces from that is really challenging. It's much easier to deal with it, to be proactive than to wait.
I think that's been your line throughout all of this is proactive. Like
Yeah,
you should get
but
a pat
that's
with
right. But
proactive
that's
on it.
that's what yeah, I know. But that's what education is, right? Like that's
Yeah.
what I mean, that is really why that's for every reason, even from a protection of the employee perspective, right? When you allow somebody the chance to disclose a substance use disorder to get the help that they need, you've been proactive, right? So it all comes down to it's for the employee's best interest, it's for the leader's best interest, it's for the employer's best interest. That's really what it comes down to. So that's what education is proactive. Yeah.
All right. So all of this stuff we talked about over the last hour is all going to boil down to this last line here. So it's like, where can people learn more about
Yeah.
ASAP and connect with the FFD learning?
So really our website is probably the best place. So ffdlearning.com. It goes through, everything that is available and then just reach out to me. I mean, I have people reach out to me on LinkedIn. I have people emailing me, and calling sometimes. And, but you can get all the information on the website. So ffdlearning.com and contact us. Happy to talk.
All right. And I'll put it in the description box, on the YouTube channel, and put all that on there. Okay. So now this is my very last thing.
Okay.
My very last thing. Um, you so Corey is her husband, everybody. Corey's her
Yes.
husband. So Corey's behind the scenes, and that's my guy. Every time I see him, I just hug him. That's my
Yeah.
guy. And
He's
so he said if I was going to wear a hat, but you had a hat over there and you threw it up, but you didn't want to put it on and mess up your new hairdo.
I don't really like to wear hats, but Corey did say to me, if Greg's wearing a hat, you're putting on a hat. And of course, this is the one that he gave me. So,
So the reason I asked about now your hair all frizzy and everything. So
yeah, now it's,
so,
yeah, I should
so
just keep
now
the hat on.
you're in Canada. How you end up with a Texas Longhorn hat? I was going to say that in the very beginning, but
Yeah, yeah. Well, yeah. My husband and his friends took a trip and they all had custom made hats made. So, They
So
do
that's
these
how.
boys trips. They do these boys trips. So he did give me an appropriate one, I have to say, to wear. So it wasn't just,
So
he
that's
was
why I
picked
said
for
the
a
boys on
reason.
the side. Okay,
Yeah, I know. See, it's all
custom.
custom. Yeah.
Okay, okay. I
And
was wondering, like,
that's how I ended up with it. Yeah.
how you end up in Texas and you way in Canada?
I
But
know.
but anything, it was so nice having you on.
Great talking
And I
with
will
you.
see you
Thank
in
you.
Dublin.
I will see you in Dublin. Yeah, I'm looking forward
I
to
will
it.
I'll be in Dublin, and I'm looking forward to that. And for everybody, to make sure you like, subscribe on the channel. The video will be, posted up there for you to share, and I hope people reach out to you for guidance and
Thank you.
and understanding, especially with the marijuana as that continue to grow. And we didn't talk about fentanyl and
No.
the rising concern with that coming or whatever. But I know that you touch on all of those
Yeah,
things.
absolutely. Reach out for
So,
anything. It's been
so
great
before
talking
we
with
do,
you. Thank you.
so before we do leave, I do want to ask about that because it's my show and I can do whatever I want. So I'm going to recant on that very last line.
That's okay. Yeah.
What do you have, if you want to say anything, on the rising fentanyl?
Yeah.
Uh,
I will say that, when we look at our substances, and this is when in drug checking all across the US and Canada, 'cause it's essentially the same, is that no drug is what it used to be, meaning cocaine is not cocaine, methamphetamine is not methamphetamine, opioids are not opioids, whatever one you want to choose, heroin, morphine, etc. They are all, even fentanyl is not fentanyl anymore, truthfully. So all of these substances have in them, they are contaminated with other fentanyl analogs, other very potent either opioids or benzodiazepines, veterinary medicines, etc., within them. And so it is leading to not only more unintended overdoses, it is leading to people becoming much needing to use it daily much faster because the potency has increased significantly. And, it is, we start talking now about adding fentanyl to our panels. It's important. Why is it important? It's important because most people who have a positive test for fentanyl are using substances in a very dangerous way. And so, I mean, there is when people get help for opioid use disorder, for fentanyl use, for any kind of opioids that they may be using, which for the most part is fentanyl these days, it makes a very big difference in their lives. There is great treatment that is out there. It allows people to sort of live their lives without having to use something and without being at risk of overdosing. You know, just a quick thing about overdosing. We always talk about opioid overdose deaths, and but there are significant brain injuries when we think about it when people overdose. Because when they overdose, what's happening is that there's a period of time where they're not getting oxygen to their brain. And so even if someone doesn't overdose and die and they overdose, there's significant consequences to that. And all of these tainted and contaminated substances and fentanyl use are causing more of that. And so, the importance of really managing it, dealing with it, seeing it, being prepared in your workplace for it, because it will happen in workplaces, is vitally important. And again, talking to people about it. When I tell my patients and I show them what their drug test was positive for, this is us doing chromatography testing where we're testing everything so I can see, methamphetamine, like I can see all the different xylazine, I can see all the different substances that are in what they're using. And I say to them, what you're using contains A, B, C, D, and E. It's eye-opening to them. And it's scary. And, they can understand it on a bit of a different level. So I think, again, being informed and educated and knowing what's out there and knowing what people are using and what we're seeing is really important.
and being proactive.
Yeah, being proactive. Yeah. Yeah.
All right.
Yeah.
Well, that's it for me. I these
Okay.
things I'll sit here and start coming up with stuff, whatever. But thank you so much for
Thank
coming
you.
on the
Thank
Everything Drug
you.
and Alcohol program, and I look forward to seeing you
It's
guys
been
in the
great.
future.
We will
Uh,
see you with a big hug in Dublin.
In Dublin, in Dublin. So I will see you soon. And to everybody else, just like I always say, you'll know when something is right for you because when it comes along, it won't complicate you, it'll compliment you. So I will see everyone later.
Thanks.
Talk to you later.
Bye-bye.
Omido for the beat.